Thank you again to the people on the live stream. Thank you to the people in the audience. A perfect segue into the next panel or next discussion we're going to have, which is a conversation with Dr. Keith Salzman from IBM. IBM is the underwriter of today's event, so we thank them for the support that they've given us to this event and others. Dr. Salzman is a health fellow with IBM Center for Business of Government and the Chief Medical Information Officer with IBM's Global Business Services. So there's a lot going on right now in terms of medical records and technology, in terms of how we deliver care directly to the veterans, how we use technology to support the Veterans Affairs Administration.
Thanks, man. I know that was
as well.
Fire.
So a little bit of bio and background from Dr. Salzman.
Went well.
He is
Hey, sir, how are you? Good to see you. I thought I saw you in the audience.
So that's not just in my head. Okay, great. Thank you. So prior to joining the IBM, Prior to joining IBM and the IBM Center, Dr. Salzman was Chief Medical Information Officer at the Madigan Army Medical Center. He also established the Informatics Division in the Military Health System, which we've talked a lot about over the last couple of years. He's also former active duty in the U.S. Army. He served for 22 years there, both as a active duty member of the medical community there as well, right? He's a member of the Order of Military Medical Merit and has the Meritorious Service Medal and an Expert Field Medical Badge. So please join me in welcoming Dr. Salzman. So thank you for joining us today. So let's go ahead and get started. We've talked about the veteran, we've talked about technology, we've talked about a number of the scandals that have impacted veterans. You've got a unique perspective on this, a unique set of experiences from both a member of the military, a doctor in the military, and then on the outside in informatics, and also in government as a Fed, basically. So what have we accomplished from your perspective, over the last, couple of years, and with the promise of technology and medical records, what do we have to come, and what are some of the things that we should look forward to?
I think some of the big accomplishments have come out of the military and the VA working together. They don't get a lot of credit for doing that, and I testified to Congressman Miller's committee about what was going on with DoD VA sharing. The fact is that it wasn't being done before between big organizations, and in 2004 I had the good fortune of coming back to Madigan from Germany and starting to work with sharing of information between the two organizations. So through that process we took a disciplined approach of building solutions according to standards, which they're kind of immature standards at that point, but the concept of using standards that worked and then adopting new standards as they became available. So what you saw around the country when the Office of the National Coordinator started test beds of sharing between the DoD, VA, and the private sector was that the DoD and VA had the templates to start that process. And that became the groundwork for the standards and interoperability framework, which once they opened up that can of worms of what medical information needs to be shared, you have long-term care facilities, you have skilled nursing facilities, transitions of care. There's a lot more besides just a doctor's documentation about care. So the groundwork that was laid by the DoD and VA, they've been leapfrogged by people that have more resources and more technology that they can adopt more easily. But I think they should get credit for laying the groundwork, and then they should be pulled along as far as, and we'll talk a little later about partnership between industry and government, where I think industry has the resources, time. You think about the veterans coming back and bringing their experience as a user into the design of solutions. That's a powerful capability that while you're doing the mission of either fighting a war or delivering health care to military service members or vets, you really don't have the bandwidth to do everything else. So
what should we look forward to? I mean, we've established standards and interoperability. We've got medical health records just as almost an expectation of the entire country now versus in 2004 when it was not everybody's expectation. Maybe it was a wish for people, but it wasn't an expectation. So what are some of the things that you see looking down the pike that we should keep in mind?
Well, the HITECH Act, there's an article that just came out about the effect of the HITECH Act on the implementation and and transformation of medicine. And Clay Christensen's written a lot about transformation, and he sees it as this curve that if you do a logarithmic transformation of, you have a linear path that's predictable. So the article said that the HITECH Act really didn't influence the adoption of medical records. That was on its way. So interesting kind of coexistence of, or collision of efforts. But the net is that you've taken all these people that have their records in paper and you've put them on electronics, but they're siloed, so they don't talk to each other. So what's emerging is the ability to share that information. And necessity is kind of the mother of invention. So the DoD and VA, when they had to start working together more, sharing patients through the wars, that forced them to really look at how they shared information for disability exams, for exchanging patients back and forth in the system. And then if you look at Kaiser, as they implemented an electronic record, they had to do the same thing. So there's partners in industry that have been on the journey for the same reasons. They've just been forced to have an internal capacity to share information. Now, with the change from fee-for-service to value-based and outcome-based care, that change is changing from hoarding your information and doing more services to sharing your information so you get better continuity of care, and you economize on you don't put patients through tests that are duplicative and introduce harm at each step, but you do your test once and share it.
So we've talked a little bit about the collaboration between DoD and VA and also the role that industry can play. So how can industry and government work together to improve the delivery of services for the veteran?
Back to the core mission, the VA's core mission is to deliver benefits. It's not to be an IT company. Mm-hmm. And so I think that industry has a tremendous ability, and particularly large businesses like IBM that have to solve their problems internally for 400,000 people. The VA has that many people, the Army has that many people. They have the experience and the bandwidth, if you will, to bring those solutions, bring in ideas about governance, about innovation, about how to capture the ideas that are out there in your workforce and bring them to market so that they can solve your problems. When the VA now, in the past, they were confronted with poor service and those kind of things. And the thing that's amazing about veterans and the people that take care of them is that they're really committed to their job. So they're not trying to do a bad job, they're trying to do the best they can. But a lot of times the culture and the bureaucracy gets in the way. So in the 90s, they just took HEDIS measures and made that a goal to drive their organization. And they delivered the best care anywhere. There's a great book about how the VA was transformed. So I think the VA rank and file has that capacity. It's just they need the leadership and to walk them through that. Scott Blackburn came and talked to us, but he's a vet who was hired by Secretary McDonald to look at, to take a My VA campaign and look at the workforce and help them. You want to make the customer satisfied, but if your workforce isn't satisfied, then the customer is not going to be satisfied. So they're taking a new approach to looking at bringing people from outside, from industry, into the VA leadership to help with that cultural transformation. I think those initiatives are going to go a long way to catalyzing a change within the organization. It's not an easy task, as we heard earlier. So.
No, I mean, it's the task we've been talking about for years, and we'll probably continue to talk about for years. So thank you for joining us today. Please join me in welcoming and thanking Dr. Keith Salzman of IBM, and thank IBM for their support today.
Thank you.